Hello and welcome to another episode of Burgundy Talks. Last week was a fun episode. I don't know how many of you saw it. It was a Q&A session. This week we're going to be doing something about mental health. Yeah. So we're going to be talking about, how you can care for someone with mental health issues, right? Okay. So I'm going to list them out. If you want to know more about this, definitely keep watching. So first of all, how do you even know someone who has mental health issues? They might tell you, straight up front. Some people do actually come up to you and tell you that, I'm depressed, or I think I have anxiety issues. It's nothing to be ashamed of. This is 2021. We all know this. And sometimes you might not easily know. They might not tell you. You might just, if you're sensitive enough or you are empathetic enough, you would see that this person is a little off, or maybe this is not their usual behavior. So you can tell that, okay, maybe something is wrong with this person. And that brings us to our very first point, which is to create a safe space. When I say create a safe space, it means that create a space, an atmosphere where this person can talk about what they're going through without judgment, right? Where they feel you're not the one that's going to tell them that, oh, I'm not going to judge you. They're going to feel that this is a safe space to, let out what I'm feeling or how I'm feeling. So it's up to you if you want to help to create a safe environment. Second point is let them share how much or how little they want to share. So it's not up to you to, try to pull the words out of them. That's like something that most people do and is very, very, very wrong. Let people say, how they feel or not. Do you understand? This person's already suffering from mental health issues. Do not compound it by trying to, force them to talk about it. It's unhealthy for them. Take it from me, it's unhealthy for them. So let them talk about it if they want to, and if they don't want to, it's all right too. When someone is going through that kind of stuff, they might want to overshare. If you are trying to help, create that safe space. And if they don't want to share, that's fine. Just, let them know that you are there for them. Because it takes trust and a little bit of courage, a lot of courage for someone to share. Oh my God, this third one, you're not a therapist. And even if you are, you're not their therapist. They have not signed on to you as their therapist. Do you understand what I'm saying? So do not try to psychoanalyze them. Do not try to diagnose them or try to, this might be what's wrong with you. Maybe they cannot articulate what's wrong with them, but this is not the time for you to start putting two and two together. Even if you are, let it stay right here, inside. Do not blurt it out, in their faces or in their face. Be sensitive, basically. This one is kind of close to, not diagnosing them or psychoanalyzing them. When you ask questions, keep it open-ended, ask them, do you want to tell me how you're feeling? Or, how exactly are you feeling? Can you put it into words? Do not say, oh, I see you're feeling really low. No, you don't know. You know nothing, Jon Snow. Yeah. Another point is, do not try to, prescribe. What you can do is share. Say something like, when I'm going through, something similar, or when I'm feeling the way you just explained, this is what I do. When I'm feeling, the way I think you're feeling, this is what I do. Or this is what I think might help. I'm not prescribing, I'm just sharing. Share. Approach is everything when it comes to dealing with someone with mental health issues. Another point is listen carefully to what they tell you. Don't, be absent-minded. I know that we're all guilty of this, but when you're trying to help, it's a different thing when you're less concerned. That's fine too. But if you're actually trying to help someone with mental health issues, try to give them your full attention, and do not dismiss their feelings, because that's kind of like what we do. You don't have to agree with everything that they are saying to you, but just let them know that you respect their feelings and that their feelings are valid, because they are. Although that's kind of alien to us in Nigeria. Once you don't agree with something, you kind of, there's an immediate rebuttal. No, it doesn't have to be like that. So here's the thing. You can offer to help them look for professional help or advice. You can offer to, take them to, a therapist, a counselor, someone that is capable of actually helping them professionally. You can offer that. And they can refuse. The crux of the matter is that you let them know that you're there for them, because that's all they need actually. My last point is know your limits. You're not a doctor, you're not a therapist. And like I said, even if you are, you're not their therapist, right? So know your limits. If you think that they're in danger or they can cause harm to themselves or those around them, go ahead and seek professional help for them. Yes, that's the time to get practical, tell someone or ask about, how you can help this person, because you feel that they might be in danger or people around them might be in danger. While it might not be easy to immediately find a therapist or a counselor for someone with mental health issues, you can help, but try to follow these guidelines. Okay, so people with mental health issues sometimes usually have a crisis, and what you can do is stay calm. Try as much as possible to stay calm, because maybe you've never been in that situation before. Your best bet is just stay calm, keep reassuring them, that you're there for them, everything is going to be all right. And if it seems like you're talking is not doing anything better, you better stay mute. Just stay calm while looking for professional help, because everyone dealing with mental health issues, they need help. Even those with high functioning depression. A lot of us are walking the streets of this earth with HFD. So everybody needs help, basically. I've heard someone say that if you grew up in Nigeria, you need help. If you've not found help. But on a serious note, if you know anyone with mental health issues, you can send me an email and we can work that out. So basically, I just wanted to give us, some quick notes on how to deal with, people with mental health issues, family, friends, anybody around us that might have mental health issues. I've had to deal with people with mental health issues before. People have had to deal with me. That's how life is. Okay. So that brings us to the end of today's episode of Burgundy Talks. This episode was not easy for me to shoot. It's with mixed feelings, if you know what I mean. So yeah, I'm gonna see you guys next week, right? Subscribe, like my videos, and turn on notifications, people, and share my videos. Thank you so much for watching. It's been another beautiful episode. See you next week. Toodles!